In light of Sexual Assault Awareness Month, RevNow is partnering with Dr. Vanessa Rodriguez, a trained therapist who specializes in sexual assault survivors, to create a three-part series about survivor mental health. Thank you for being with us today, Doctor. Now, in the last part of this series, we will be discussing how to support friends and family who have been abused. My question for you is, how should you react when your friends tell you about their sexual assault experience, like verbally and non-verbally?
So this is a tough one because if someone discloses to you their recent or past assault or victimization, it's hard not to have a reaction, right? Like because hearing that, especially depending on the type of relationship we have with that person, we're human, and then sometimes trauma brings up trauma, right? And so sometimes our reactions can be really deep in our stuff. And so I think kind of just first of all normalizing to the person who's getting disclosed to, right, hearing it, kind of normalizing that it's okay to have a reaction, first of all, okay? But again, in an ideal situation, right, you don't want to judge them. You don't want to criticize them. You don't want to push them, right? You don't want to pressure them. You need to do this. You need to do that. Why are you still with him? We need to report to the police. Why are you still talking to him? How come you haven't blocked him? You know, so on and so forth. And of course, it's all with good intent, right? But then all that does is really, again, here's this thing, right? We feel ashamed. We feel stupid. We feel silly. What's wrong with me? What's wrong with me? I can't, then we feel as if we're letting down our friends, and so the big thing is to try to suspend your judgment verbally anyway, because again, we're human. Try to suspend your judgment. Try not to push, try not to pressure, and also kind of again just try to be an ear to listen to. And sometimes no words is okay, right? Sometimes sitting in your own anxiety as a person receiving it, that's okay, because as a friend, and we say we love this person, it's our friend, family, close loved one, we want to fix, we want to help, we want to alleviate their pain, right? And so sometimes we get angry, like, what happened, what's going on, we want to advocate for them, which again is all coming from a good place. It's great, but it's not our life. It's not our life, so we have to support them and really kind of sit again in our anxiety, right? Suspend our stuff, because we might be the only person that they've ever felt comfortable or close enough to disclose to. So you want to make sure, not to put pressure on the other person, but we want to make sure to not have that experience of disclosure be an additional trauma for them, where they now have learned, you know what, I'm not going to say anything. I'm not going to say anything because look at the reaction I got. I got a lot of heat on this. I got a lot of judgment. They told me to do A, B, C, D, F, G. So just forget it. I'm not going to say anything because that was a big fail. And I feel worse than I thought I would by disclosing to this person. So I'm just not going to say it. And then that's when that person isolates more, gets more depressed. And so as a friend or loved one, just again, no judgment, no pressure, and just being there. And you don't need to get all the gory details about what happened.
Okay. And how do you recommend allies show empathy and caution when it comes to physical intimacy? Knowing that it's common for someone who has been sexually assaulted to shy away from physical touch, how do they remain patient?
So are you talking about an intimate partner or like
I'd
a
say
friend?
I'd say intimate partner.
Okay, so again, I when you are sexually assaulted or victim of rape, and again, it is the most extreme form of boundary violation. And so trust is completely broken. Safety is completely broken. Um, you feel completely disempowered. Um, and so that when it comes to intimate partners and relationships and intimacy, I think that is the best framework to go with, right? Intimacy, vulnerability starts within, right? Starts with the heart. Um, and then body follows down the line, right? But especially for victims, right? We need that emotional security. We need that emotional safety first and foremost before even talking about physical touch, right? And once that is established, right, the tempo ought to always be on the victim, right? Beginning, this is like kind of reintroducing intimacy I'm talking about, right? Because I also don't think it's healthy or fair if you're in a relationship and the victim, for months, years, they don't do their work. They need to do their work, not for their partner, but for themselves, right? So it's not healthy or fair to be in a relationship and have the victim not do their work, right? And work looks different for everybody, but so at least that kind of foundational work of having emotional intimacy, safety, security, all of that stuff, and then again you begin to introduce touch, right? Slowly, and again, always at the victim's tempo. And then check in, check in. And I know people always get, awkward when people talk about sex. But, sex is not an ugly thing. It's a beautiful, it can be a very beautiful, um, intimate connecting thing within partners. And so it's okay to talk about beautiful things. It's actually beautiful to talk about beautiful things, but people get a little uncomfortable. So it's kind of changing that narrative too, right? To feel empowered again, to feel safe again, to feel trust with your own body, and having someone else touch your body, and you even feel comfortable touching someone else's body, right? And so, and all of that is on a different time frame, again, for everybody. But I think, again, I can't stress enough is the emotional trust and intimacy to begin to reintroduce physical touch.
All right. And then my last question for you is, what tips can you give parents when it comes to having a child who has been through sexual trauma, like mom specifically or dad specifically?
Who's their children or the mom?
Their children. Their children are sexually assaulted. How would the parents deal with that?
Oh, okay. That's a tough one too.
Yeah.
That's a really, I too have been a victim of rape, and mine's a little bit more unique, in the sense that my family physician had essentially drugged and raped me during an appointment, during a medical procedure. And so he was a family doctor of ours for years, and my mom also began to see him as her family medicine doctor, and then later on my stepdad started to see him, and this was all after the fact of my assault, right? I didn't say anything um, um, for about, well, I disclosed initially a couple weeks later to a sister, but about maybe 4 or 5 months later, I actually did report it to local law enforcement, and I went through that whole process, where I did a pretext phone call, which is essentially recording, getting him to admit or acknowledge what he did, and he did. and they arrested him. And again, it's a very long story, but we can probably have a whole nother segment on kind of law enforcement and that experience through the courts and all of that. He ended up getting his license revoked, which was great. But coming full circle, it was very difficult to disclose to my parents, what happened. Especially mine's a little bit more unique because they had a relationship and it blended in. So I had even more shame. Again, my shame was, you could fill up a house. How much shame I had. And so, but I ended up disclosing it to them. And it was a secondary, they call it secondary trauma, right? Vicarious trauma. My parents were traumatized from the disclosure, but they too, alongside during my experience and journey through all of that, they were also going through it with me, and so I think it's especially important for parents to seek the help that they need too. It's not that common that they have support groups for parents, but I have seen one maybe years ago, but it's a definite need for parents. I do talk to parents. I have talked to parents whose children have been assaulted, and the talk about the guilt that they experience. It's tenfold, and they feel helpless, and they want to fix, and they want to rescue, and they're angry, and they want justice. So I would highly suggest that the parents that get the help that they need to through either through couples generally, or just with a clinician.
Okay. Well, thank you for being with us today, Doctor. Do you have any final thoughts or comments before we sign off?
No, I just want to thank you for doing this. I think this is wonderful. I think with what's going on right now with COVID-19, it's obviously terrible, violence against women. But the somewhat silver lining is that now it's really getting the publicity that it needs, the attention that it needs, because sadly this is nothing new for people that are really doing this work. But now we're getting the support and attention. So thank you for doing this. I really appreciate it.
And thank you for sharing your story, and thank you for taking time to share your knowledge with us and those in need of it.
Of course, and I have a website. I'm sure you can probably put a link. It's vmrtherapy.com. And so I'm in private practice here in San Diego. And so anybody can contact me. I love what I do. I'm blessed to be able to do what I do. And so I'm here to support to anybody who might need it.
All right. Well, thank you so much, and stay safe out there.
Thank you. You too.